What tests diagnose orthostatic intolerance in chronic fatigue syndrome? Have you ever wondered how doctors diagnose orthostatic intolerance in chronic fatigue syndrome? This condition, also known as myalgic encephalomyelitis, can be tricky to identify. It primarily involves assessing how the body reacts to changes in posture. Several tests help healthcare professionals pinpoint this issue effectively. The tilt table test is the most common method used. In this test, the patient lies on a table that tilts from a horizontal to a vertical position. While this happens, the healthcare team monitors heart rate, blood pressure, and any symptoms that arise. This test can reveal abnormal heart rate or blood pressure responses, which are common in orthostatic intolerance. Another useful test is the active stand test. This is simpler and can be done at the bedside. The patient lies down and then stands up while their heart rate and blood pressure are measured. This test can indicate if there are abnormal increases in heart rate or drops in blood pressure when standing. Heart rate variability and autonomic function tests are also important. These tests evaluate how well the autonomic nervous system is working, which often gets affected in chronic fatigue syndrome. Some of these assessments include deep breathing exercises and the Valsalva maneuver, which help assess the balance between the sympathetic and parasympathetic nervous systems. Additionally, 24-hour ambulatory blood pressure and heart rate monitoring can provide valuable insights. This method captures the fluctuations in blood pressure and heart rate during daily activities, helping to identify patterns consistent with orthostatic intolerance. While there are no specific blood tests to diagnose orthostatic intolerance directly, laboratory tests may be conducted to rule out other conditions. These tests can check for issues like anemia, thyroid problems, or electrolyte imbalances that might cause similar symptoms. In the context of chronic fatigue syndrome, these various tests are crucial for confirming orthostatic intolerance. This condition can significantly impact a person's quality of life. Therefore, accurate diagnosis is vital for developing effective management strategies. These may include recommendations for increased fluid and salt intake, the use of compression garments, medications, and tailored physical therapy. It is essential that these tests are performed and interpreted by healthcare professionals experienced in autonomic disorders and chronic fatigue syndrome. If you suspect you have orthostatic intolerance, consulting with a knowledgeable healthcare provider is the best course of action. They can offer personalized advice and treatment options suited to your specific needs.